Good morning, everybody. I'm Muyibat Adelani. I'm a hip and knee arthroplasty surgeon in St. Louis, and I appreciate you guys having me here today to share my thoughts on allyship. I don't have any financial disclosures. However, I do have one disclaimer. This talk is based on some literature as well as my personal experience, but it's in no way intended to be comprehensive, as I just can't get everything about allyship into one talk. So hopefully we'll be able to discuss a few key points. So the first is it's important to define what allies are. Allies are individuals who work to end oppression by advocacy of those who are oppressed. They're typically people who have power within a system that can leverage their status to enact a positive outcome for those without power. We typically think of allies as being whites or males, but I think we can expand that to other people who have power in the system. Heterosexuals, for example, or even senior partners could also be allies. Really anybody who has favor within a system. Allyship is critically important because we work in systems where some people just don't have a voice. Allies are people who have access to spaces that other people do not. They have access to leadership. They are at the table when important decisions are being made. They have a voice that other people are more likely to listen to. Because of this, they have the ability to push for change that those without power just can't get on their own. So self-identification as an ally is really not enough. Allyship requires real work on the part of the ally. The first requirement is knowledge and awareness. So allies must seek to educate themselves on experiences of those who they are seeking to help. It's important to do so with an open mind, but it's also important to do this on your own accord. Too often the burden is placed on the oppressed to go out and educate other people about their experience, but it's really exhausting for those individuals. I think it's really important for allies to initiate their own education in this way. I think at this in this day and age, there's really a lot of literature, as Dr. Benson alluded to, on minority experiences, especially in medicine. So there are a lot of opportunities for potential allies to do this. It's also important for allies to learn and accept what their group's role is in the minority experience. So using race as an example, this is learning and accepting that racism exists, regardless of whether you feel like you're being called a racist. It's important to accept that you as a group or individual are afforded certain benefits because of your group affiliation. To be a true ally, you must accept this without being defensive, without being dismissive of the minority experience, and without denying that it exists. It will be uncomfortable, but I think it's important to really lean into that discomfort if you were to be an effective ally. Allyship also requires communication and confrontation. Allies must be willing to talk about these issues openly, encouraging discussion on issues facing minorities, challenging others on their assumptions, and confronting inappropriate statements, actions, and behaviors are all really important actions on the behalf of the ally. So that's really allyship from a more academic point, but how does allyship work in a practical sense? So here are my thoughts based on my own experience. First, an ally really needs to believe what the person is saying. Trying to talk them out of what they're experiencing, convincing them that they must be interpreting it incorrectly, trying to explain it away can all be quite offensive, as many of us have interpretations of our experience based on a lifetime of experiences, right? So my experience as a Black female informs my interpretation of actions in my department, which is based on my entire life, not just based on one interaction. The second is choose to be an ally because you believe it is the moral imperative. Any other justification for being an ally, such as optics, are just not sustainable for continued allyship. Understand that being a true ally may compel you to challenge people that you may consider to be your friends, and this can be difficult. However, if you're going to be an ally because it is the moral imperative, then it is imperative that you challenge these individuals to do the right thing as well. And because it is the right thing to do, don't wait for the oppressed to request your assistance. Speaking up when the oppressed don't know that you're speaking up is really important. Don't do it for show or because it looks good, but do it because it's the right thing to do. But also be ready to speak up when everyone is watching. Be willing to go on the record supporting an oppressed group. As long as allies remain allies in secret and oppressive policies, actions, and other circumstances are not called out publicly, things will never change in orthopedics. So with that, I will end and I look forward to the discussion.